Hello, my name is Josh Eisen, and I'm a urologist in Chicago, Illinois. Today's talk is going to be focused on the prostate, the enlarging prostate, and what we can do to help fix this common problem. If you're here today, either you or someone you know is probably struggling with urinary symptoms. Maybe it's tough to get a full night's sleep because your bladder is constantly reminding you it has to go. Maybe it's tough to leave the house because when that urge hits, you better be close to a toilet or you might have an accident. Maybe it's hard to initiate your stream, or when you're done going, maybe it doesn't feel like your bladder is fully emptied. If any of these symptoms sound familiar to you, you're not alone. Anyone who is born with the prostate is very likely to have enlargement of this organ as we get older. As the prostate grows, it impinges on the bladder's ability to empty, and it leads to all of these symptoms. Fortunately, because this is such a common problem, a lot of technology has been poured into the space to figure out what we can do to fix the problem while minimizing the side effects that are commonly associated with prostate treatment. Today's talk is going to be focused on one of the newer technologies to hit the market, aquablation of the prostate. Aquablation is a high-pressure water jet that's aimed at the prostate in a very precise manner to help remove this overgrown prostate tissue while minimizing the effect on nearby structures. By doing so, it helps open up this channel and alleviate all of these symptoms. So without further ado, I'm going to share my slides and we're going to go over the prostate, the landscape of treatments available for the prostate, and more specifically, aquablation of the prostate, which is a minimally invasive approach to this enlarging organ. Just a brief introduction on who I am. Again, my name is Josh Eisen. I'm a general urologist in Chicago, Illinois, which basically means anyone with any urologic issue can come into my clinic. We'll go over your symptoms and we'll figure out a treatment plan that works for you. My current office locations are in Lakeview and Lincoln Square, and I operate out of Advocate, Illinois Masonic Hospital as well as Swedish Covenant Hospital. Both of these hospitals have aquablation technology in their operating rooms, and both of these sites would be really great to get treated at. So if you have any urologic issue, please feel free to call my office. We'll get you in right away. We'll go over what's going on and we'll figure out how we can fix the problem. I have no financial disclosures. Aquablation is not reimbursing me for doing this talk. I personally think aquablation is a really great technology, and I'm here to spread the word. So a little roadmap about today's talk. Again, we're first going to talk about the normal prostate and the prostate that's enlarging, how it causes these symptoms. We'll then move on to what the current treatment landscape looks like for BPH or enlargement of the prostate. And then finally, we'll finish the talk on aquablation, more specifically what this procedure entails, what the recovery looks like, and what the outcomes look like. I think that in order to understand a normal an enlarged prostate and how it causes problems in the body, we have to understand what the normal prostate is, where it's located, and what it does. So as you can see in this picture, the prostate is a walnut-shaped organ. It sits right below the bladder and it encircles the urethra. The prostate is comprised of a bunch of glands which secrete fluid into the urethra during ejaculation. So the vast majority of the seminal fluid that comes out during an orgasm actually comes from the prostate itself. And that fluid contains nutrients and enzymes that help sperm become motile and make them healthy, and it encourages fertility and baby formation. Based on the location of this prostate, as it grows, you can see in the picture in the bottom, it impinges on this tube, the urethra. And similar to any clogged plumbing system, it leads to obstruction or blockage and backup. And when this happens, it leaves us with a whole host of symptoms that I'll go over in a second. So what are these symptoms that we see in our clinic? We in urology, we often split these symptoms up into two categories. We have storage symptoms, or the symptoms that hit us in between our trips to the toilet when we're trying to just hold urine. And then we have emptying symptoms, symptoms that occur when we're at the toilet, we're trying to pee, and we're running into problems. So more specifically, what storage symptoms do we see? We see people with nocturia or waking up all night long to go pee, frequency or frequent trips during the day to go to the bathroom because your bladder just can't hold on to as much urine as it once did. We see urgency of urination. When you do hit that threshold and you got to go pee, the urge hits you really hard and it's sometimes hard to make it, and you might experience a little bit of leakage. And then there's these emptying symptoms, and these are what I think of the ones that are due to this clogged system. So we have a weak flow or straining, having to force your belly muscles in order to get the urine going. Hesitancy, having to stand at the toilet for a while before things start, or intermittency, your stream starting and stopping as you go. In some instances, this obstruction can be so severe that men might be unable to pee altogether and might require a catheter be placed to allow that urine to drain. Most of the time, people have multiple symptoms. I'll say that. It's usually not just one isolated symptoms. A symptom. A lot of times people will come in and have a smattering of all of these. Like I said at the beginning, this is an extremely common problem. BPH impacts almost all of us who were born with a prostate. By age 50, about 50% of men will have an enlarged prostate. And this number goes up each decade as we get older, to the point where by the time we're about 80 years old, almost 90% of men will have an enlarged prostate. In terms of symptoms, symptoms usually follow along with this prostate growth. So not everyone who has an enlarged prostate will experience symptoms, but usually they do. So by age 70, about 70% of men will have some symptoms of BPH. This issue, this problem of BPH impacts all demographics, all races, all corners of the world. And so we really cannot get away from it. Only about 30 to 50% of men who are experiencing these symptoms come in and seek help. And, while this could impact your quality of life, there are definitely more scary, long-term, irreversible risks of untreated BPH. So you can see here that over time, it's one thing to develop these symptoms, but it's another thing to have permanent changes of the bladder. So you can see that over time, initially, as you have a blocked system, the bladder becomes stronger because it has to work harder to get the urine out. And as the bladder becomes stronger, um, we might experience inability to hold urine for as long because you have a more contracted a globe for urine to sit in. However, over time, as that detrusor muscle gets stronger, it reaches a point where it becomes overworked and then it weakens and really cannot do its job. And when this happens, if people come into us after the point where the bladder has already started to weaken, even if we treat the prostate, it might be difficult to empty the bladder. And so it's important to come in and be treated for this issue well before this permanent bladder damage occurs. There are other issues that we often are on the lookout for when it comes to BPH. For example, urinary retention. I already mentioned that, where people really can't pee at all, and so they have to come in and have a catheter placed. Urinary tract infections often occur because we're not emptying the urine all the way. And when there's some residual urine in the bladder, bacteria can replicate in there and can cause an infection. Bladder stones can develop for a very similar reason. The urine contains minerals, and when those minerals are just sitting in the bladder and not emptying and being cycled through, they can form stones. The prostate, as it gets bigger, often will form fragile, superficial blood vessels on the surface of it. So when we're straining to try to pee, those blood vessels can burst open and can lead to significant bleeding in the urine. And finally, in severe cases, when there's backup of urine, that urine can back all the way up to the kidneys and it can lead to permanent kidney damage. So if you have just made the decision to come see us for your urinary symptoms, what might you expect to experience on your first or second visit with us? Well, first, of course, we're going to do an extensive history. We're going to talk all about your urinary symptoms. You'll likely fill out a validated questionnaire, something like the International Prostate Symptom Score, where we're able to assign an objective score to your symptoms and figure out how severe these really are. We'll do a physical exam where we'll do a digital rectal exam. We'll insert a finger into the bottom in order to really get a sense of how large exactly your prostate is. We'll likely send a urinalysis, check your urine for any signs of blood or infection that might be contributing to your symptoms. And we'll also do an assessment of the prostate. We got to figure out how large your prostate is and exactly what shape the prostate is in order to figure out which of these treatment modalities really fits your specific situation. How do we do that? So first of all, we'll likely do a prostate ultrasound, which entails putting a small ultrasound probe in the bottom to take a quick picture of the prostate so we can take some measurements. We'll likely do a cystoscopy where we take a tiny flexible camera, travel in through the urethra and into the prostate channel to see how obstructing the prostate is. You can see in these pictures on the screen, these are some cystoscopic images of the prostate. On the left, you can see a normal prostate that has an open channel into the bladder. And then on the right side, you can see someone with an enlarged prostate. The lobes of the prostate on the right and the left are growing into the urethral lumen and causing this obstruction and therefore the symptoms you're experiencing. And then finally, we'll also likely have you pee into a special machine that allows us to measure how fast your urine is traveling in order to allow us some sense of how obstructed your urinary tract really is. Using all of these kind of data points that we're collecting on you, again, we'll be able to figure out exactly what treatment option makes the most sense for you. And speaking of treatment options, this is a very broad landscape when it comes to what we can do to help fix your problems. Like I said at the beginning, because this is such a common problem, there is a lot of help in this space. And depending on how bothered, how severe your symptoms are, we can determine what we can do to fix it. So at the kind of least invasive aspect of the spectrum, we have watchful waiting. Men who maybe are not as bothered or really don't want to take a medication or do a surgery can go forward with some behavioral modification techniques. These generally are ineffective long-term treatment options, but they can definitely help provide some relief in the short term. These behavioral changes generally include things like restricting fluid at night before bed, timing your trips to the toilet during the day so that you're not caught off guard with an urgency episode, avoiding certain irritants in the diet that can really bother a bladder that's already quite sensitive, or maybe going to the bathroom 2 times in one session, trying to really empty fully and get that urine out so you have more time before your next trip to the toilet. A lot of times, this is not enough, and so we'll resort to medications. Medications, there's a few different classes within this space, but the most common medication that we use is something called Flomax or tamsulosin, which is a part of a class of medications called alpha blockers. And what these medications do is they relax the smooth muscles within the prostate and the neck of the bladder. And by relaxing these muscles, it eases up some of the tension on the urethra and it allows us to get a stronger flow. These medications do come with side effects. They're quite common. Most common side effects include dizziness or lightheadedness, sexual side effects like ejaculatory dysfunction, and generally, these medications are intended to be taken long term without an end date. And so, a lot of men, depending on their situation, they might not really want to be on a medication in the long run. Or maybe if sexual function is important to them, they don't want to be taking a medication that is impacting that. And in certain prostates, based on the shape and the size, medications just might be ineffective. So then we move on to more interventional based options. There are minimally invasive techniques that have come about in recent years that are really good at fixing this obstructed channel while avoiding side effects. These include things like Urolift or implantation of little kind of staples into the prostate to hold the tissue to the side and open up the channel, or Resume, which uses a water steam technology to essentially vaporize the tissue that's overgrown. These options do preserve sexual function, which is great, and they generally are quite effective. However, they are limited by how large of a prostate they're effective on. So, generally speaking, prostates that reach a certain size do not qualify for these options. So then we have the more traditional surgical techniques, which use usually a thermal energy or a heat source to remove overgrown prostate tissue. The most common one that we use and the gold standard is something called a TURP, or a transurethral resection of the prostate, which is where we essentially use an electrical loop to scrape out or to remove this overgrown prostate tissue. We can also use a laser, which can vaporize this prostate tissue, but both of these technologies use heat. And so there's a higher rate of ejaculatory dysfunction after surgery, erectile dysfunction, and even urinary incontinence in very rare instances. And so there's a lot of treatments. You can see that here. And all of these are legitimately good options for many men. However, they each have unique pitfalls. Some of them might be ineffective. Some of them might have a lot of side effects. Some of them might not really apply to all prostates. And so this talk is going to focus on aquablation, which is less invasive, more precise, and safer than the traditional surgical techniques. So this just kind of goes into a little more depth about the trade-off between effectiveness and the side effects that are seen in our traditional surgical techniques. You can see that in our minimally invasive technologies like UroLift and Resume, you have preservation of sexual function, but maybe symptom relief is not as strong as these traditional techniques, which often prioritize symptom relief, but do come with some sexual side effects. A lot of men who are coming to see us for BPH feel like treating this problem often is kind of signing up for this permanent sexual change. And I want to be clear that that is not always the case. We have options available that can preserve your sexual function while also being effective at fixing these urinary symptoms in a durable fashion. So here we come finally to aquablation. Aquablation therapy is a robotically controlled high pressure water jet that is aimed at the prostate to remove this tissue without using heat. And by avoiding heat, we're able to save some important structures like the sphincter or the ejaculatory ducts and preserve really normal genitourinary function. So the general roadmap, and we'll go into a little bit more detail here, but we use an ultrasound during surgery to precisely map out each individual's prostate. So an ultrasound goes into the bottom once you're asleep, and then we are able to very accurately visualize your prostate and mark out where the boundaries of your prostate are and where we want to treat the prostate. And then we insert a camera into the urethra and into the bladder, and the tip of that camera has a very fast water jet that comes out of it. And that water jet, we import the coordinates that we had previously measured into this water jet, which then applies the plan to the prostate. Avoiding heat energy avoids damaging nearby structures. And the good news is aquablation is really effective for pretty much any prostate of any size. And so, unlike some of these other technologies that are a little bit more reliant on the shape and the size of the prostate to see how effective they are, aquablation can be tailored to each individual prostate, which makes it a really nice, wide-ranging treatment option for many men. All right, so I'm going to just show you kind of our first part of this procedure. You can see in this patient, we have an ultrasound in the rectum. We can see the prostate very nicely. The very kind of left side of your screen, that dark area is the bladder. And you can see the person doing this surgery is modifying these coordinates and moving them around to adjust them based on this person's prostate. Um, And as you can see, we're able to protect certain areas that we know provide this important function, such as sexual function or urinary control. All right. And then after we're done putting those planning coordinates in, where we insert a camera into the urethra, and you can see the tip of that camera has this high pressure water jet that goes forward with the plan that we've imported and removes this overgrown prostate tissue. And you can see it from both the side, the cartoon image, but also there's a cystoscopic view that just showed up on the bottom of the screen. And you can see that we're able to apply this water jet, remove the kind of tissue that's being obliterated at the same time, which is a really safe and effective way to clear out this channel. All righty. So what are the outcomes? Aquablation has been studied in some really large clinical trials, Water 1 and Water 2, and they have really shown very strong outcomes in efficacy and safety. Men should expect to see about a 50 to 70% reduction in their International Prostate Symptom Score, that objective questionnaire score that we talked about earlier on. There's going to be an objective improvement in the peak urinary flow rate. So if you pee into that machine and we measure how fast your urine is flowing out before and after the surgery, we expect to see a significant improvement in how fast you're able to pee. And really, we see these benefits being sustained years after the procedure with really low retreatment rates that are really on track with our gold standard TERP technology. You can see in this studies for more kind of specific numbers, about 94% of men at about 5 years did not have to go in for another type of treatment for their large prostate. So, what does the logistical kind of aspect of this look like? What is it going to look like for you to go through this therapy? You're going to come to the hospital. We're going to have you go through this treatment, which generally takes about an hour under general anesthesia. You'll wake up with a catheter in place, which will help allow some of the bleeding that naturally occurs with this operation to resolve. Generally, most of my patients will stay in the hospital overnight and will be discharged the next day. While you're in the hospital, we'll have some irrigation running in and out of the bladder called continuous bladder irrigation to help relieve some of this bleeding that is occurring. After about 1 to 2 days, the catheter will be removed. You will be discharged from the hospital on post-operative day 1. And whether or not you're discharged with a catheter or without a catheter, once that catheter is removed, you should see pretty instant results with regards to your urine flow. There's often a period of healing that takes place where the prostate kind of going through the kind of healing process. And what that might result in is a little bit of a overactive bladder for a few weeks, maybe more frequent trips to the toilet or more urgent urination. Some people will experience a little bit of a burning sensation while they're recovering. But after a few weeks, you can resume normal activity, and at that point, we'll likely start to scale back on any medications you may be taking for your prostate with the goal of getting you off all of your prostate medications and having good long-term results. So, who is an ideal candidate? You can see Aquablation does fit into this algorithm for BPH really anywhere along the way. If you have moderate to severe prostate symptoms, if you are not responding to medications, or you don't like how the medications are making you feel, or you just simply don't want to be taking a medication every day, maybe you have a prostate that's large and not amenable to some of these more minimally invasive technologies. And very importantly, if you care about preserving sexual function, specifically ejaculation, aquablation is probably a really good option for you. So you really don't have to struggle anymore. These urinary symptoms are extremely common, like I've been saying all along. We're really good at getting used to these symptoms, but you really don't have to. Later life is not meant to be sitting near a toilet and having to go to the bathroom all the time. we have really good, effective, long-term treatment options for you. And the recovery from these types of procedures is really much easier than it once used to be. So I've been kind of going at this for a while. You know, you can take my word all you want, but I'm going to just show you a brief patient testimonial that can kind of help solidify what I've been trying to get across throughout these past 20 minutes.
My name is Howard. I'm a 68-year-old retired police officer. I first noticed that I was having problems urinating probably 15 years ago. Tried medication, all kind of lifestyle changes. Nothing seemed to work. And then the urgencies got worse and worse. Having BPH affected me by not being able to do simple things like couldn't walk my dogs or walking around the mall without having to know where the nearest bathroom is. I would urinate in a bottle in my car and then throw it out when I got home. I was in New York City following 9/11, and that's where I got hurt with COPD. The medications that I was taking for my BPH seemed to have had a side effect where it was causing upper respiratory infections. I just couldn't take a chance with those medications. They were causing more harm than good. It wasn't helping my flow. It wasn't helping me sleep through the night. I never went into urinary retention, but it was heading in that direction. I did a lot of research, and there were so many things out there on the market that I didn't know what would be the right fit. I had the prostate arterial embolization done twice. It didn't take either time. And this doctor was open-minded enough. He said, maybe you should check out something called aquablation. I made an appointment to meet with Dr. Schwartzwell, and I told him, I don't want to try something that's not going to work. And he looked at the MRI, says, I think that I can help you with aquablation. When I chose aquablation, I felt like it was more of a fail-safe system built in there because you not only do you have the doctor's talent in case something went south, but the robot is the one that's controlled to the smallest amount of cutting involved with the high pressure water. I was released the next day, and the doctor came in the morning and said, I'll see you in a few days and let's see how it's going and how you feel. And morning of the fourth day, I went back to Dr. Schwartzwell's office, laid on the table there, and then they pulled the freaking catheter out of you. And once it came out, I had like a relief feeling. It just flowed out of me like you opened up a giant channel. Just everything came out. And it was great. I was like, I can't believe it's working like that. And it just got better and better. And they say that it takes 3 months for you to reach how good you're going to be. And he was right. I'm happy as hell I got this done. I feel like a garden hose. I don't have any sexual side effects. Just to be able to sleep better through the night, to not having to run to the bathroom and have control of your bladder. I can go to a restaurant without having to excuse myself a couple of times to use the restroom. I think it's amazing. The whole process was amazing. I would recommend aquablation to anybody that has the same symptoms. I'm very thankful I had this procedure done. It's a whole new lease on life. My name is Howard, and I'm an aquablation therapy patient.
All right. So that's really it. Hopefully you've learned something today. Please, if you have any questions, if you have any urologic issues at all, whether it's BPH related or other, call my office. We'll get you in right away and we'll figure out a plan for you. Thank you so much and have a great day.